Hey, everybody. Welcome to another exciting episode of Clinic Gym Radio. I am your host, as always, Dr. Josh Satterley, and it is my pleasure today to be joined by Dr. John Rosa. John, how are you?
Very good, thanks. It's a pleasure to be here. I'm glad you invited me.
Yeah, well, the pleasure's all ours, and very excited. You know, as I told you before, at the end of every podcast episode, I try and inspire our peers to go out there, maximize your license, and live the life you dream of. And if anybody has ever seen you speak or knows anything about you, you have tried to wring every single drop of value out of your chiropractic license as humanly possible. Yeah. So I commend you. I thank you. It's great to see that because, you know, we are our peers. We share their license, and that means we got to smack the deadbeats around. And then there's guys like you that are increasing the value. So I love it. I love it. So, for those listening, can you give us a quick synopsis of, I don't know what to call it, the empire of which you have built upon your license?
Well, yeah, I never did anything once. It was like I came from Hackensack, New Jersey. It's Italian neighborhood. My family lived in 5 houses within walking distance, and we lived on a corner. And myself and my brother, who's also a doc and part of my partner in crime, we had a lemonade stand in front of the house. And it would piss me off that the other side, that the stop sign, they weren't coming around the corner. They were blowing right through. So I told my little brother, go tell mom, get a lemonade stand set up on the other side. There's 2 of us, and we doubled our money, right? So, you kind of get that mentality of if something works and you know that you've created something well enough and it's reproducible, why in the world wouldn't you do it? So as we developed in practice over the last too many years. I mean, I'm in practice since 93, basically. So, but then on our own and building this group of clinics for the last 20 something years. So 16 clinics later, a couple of for-profit boards and a lot of non-profit boards, and seeing the writing on the wall with the opioid crisis, getting involved a little bit. And I could kind of go into detail how that started, but, yeah, it's not easy. And then being on boards of the colleges I graduated from, including what's formerly known as New York Chiropractic College, and staying palpably in touch with what's happening in our industry, and then trying to make a difference, and also lecturing all over the country on a crisis that I think we hold the keys to. I mean, chiropractors and PTs, and if you'll know by the time we finish talking that we not only hold the keys, but there's a war going on, and we need to all buckle up and grab a weapon and start rolling out.
Yeah. From what it looks like, just reading about you before this interview, you basically had an engine going, and then the opioid crisis was better than jet fuel, rocket fuel in the veins of the business. And that became the thing that just maybe exploded it. But you already had seems like you had great clinics, good systems, good models, integrating different care. And then this epidemic hit, and you were like, specifically the opioid epidemic. And it was like, this is our moment to show why we've been training this whole time, right? You were like I don't want to offend you by saying you're Greek, but it was the Spartans training you for that moment to fight.
Sure. You're 100% right. I built this thing was truly integrative in its sense, with medicine, chiropractic, physical therapy, rehab, sports medicine, into professional sports and athletes, from boxers, cyclists, you name it. And as that thing is growing, a lot of listeners are going to know that all of a sudden you're seeing people on certain things and medications, if you even caught it, because when you get this collaborative care or outside care and it's not within your system alone, all of a sudden this thing's popping up and there's a dependency. And then all of a sudden you see people getting and overdosing and coming back to the office and telling you about stories. And I guess when you're truly integrated, it's a little bit more visible than just a singular clinic. But it took me off balance about 2011-12 because it was really starting to heat up. And about 2016, I had a conversation with a medical doctor that I get some business from. And he's like, John, it's just bad. I mean, I wish you were here to make a bigger difference. And of course, I have no time to scratch my feet. It's like, what do you mean? So he's like, well, I have a room. If you were there, I would just walk him over to you. So, well, of course, like an idiot, the free clinic that I opened for a year and a half, I'm managing my businesses because I wasn't full-time in patients. I had some that I would see.
Yeah.
But, I said, I can manage it from anywhere. Let me just take my computer and we'll see what the guy does. Well, he walked in about 10 people a day, and probably 8 of those needed care. And we had a meeting about 6 months in, and he's like, man, I don't even feel like I pull my pen out anymore for pain patients. And I was like, well, can we run the data? So we took a look at it, and it was about a year in, and we had another meeting, and he says, we dropped our writing by like 70% for opioid scripts. And that was ridiculous. When you get 10% drop, you write a white paper. You have a 70% drop, you start telling the right people, who then get inviting you to go somewhere and say, well, what the hell did you do? That's drastic. And then eventually at the White House, and then I became a surrogate to the White House for the last 2 administrations, and I'm lecturing all over the country, and then doing some consulting work with the FDA, Homeland Security, DOJ, FBI, I mean, all the acronyms and alphabet soup. Now I kind of put together their prevention side of things when they hold their meetings. But it didn't happen. It happened because there was this spark in a process and a place. And I just got published in JMPT for this study. I did in April, we finally got published. And basically the paper reads that if you inject chiropractic PT active care into a primary care setting, you will reduce the chances of writing heavier prescriptions for opioid. When 80% of heroin users started with a prescription medication, then you know what the numbers I just said. I go to bed at night knowing that there's a good chunk of people that I probably prevented from overdose and dying. And that's what we need to do, right? I mean, we need to get on those horses and fight, because there's ways for us to knock on those doors. Now, we've never been in a better position ever in our careers and our lives and the lifespan of physical therapy, chiropractic, integrative model, ever been in a better position to make a difference. I created a marketing campaign to go after medical doctors to get business in as a result of all the stuff I was doing. That one guy shut me down. Like I couldn't go, this was in that area in Frederick, Maryland. I couldn't go to another one because the associate that was in that practice would have quit. I mean, the volume ended up with just that one. Look, back in the day, we've both been in practice a bit, right? You knocked on 100 medical doctor doors, maybe 20 said, yeah, let me talk to you. Maybe 5 listened, and maybe 1 sent you somebody because they thought you were nice guy.
Right.
But now 100 doors, it's 50 that open. It's 30 that are listening intently. And there's 10 that are like, man, thank God there's an alternative. I like this integrative model. And I'm going to start sending, because now I'm scared sugarless to write these scripts anymore. So we really do have a great opportunity ahead of us. Yeah.
Well, I want to make sure that we capture, one of the things that, what do they call that? Expert syndrome, where so much that it's hard to translate like the basics and the building steps, right?
Right.
You've already landed on the moon, and some of the folks listening might be like, hey, I'm just trying to take my first flight here. Like ease back, right? So let's go back to that time that you were in that doctor's office that called you in and said, hey, maybe I have a couple people in that doctor's office, just to give people that picture of a primary care physician. We as chiropractors, everybody has pain. Everybody has, we see that because they're filtered out. We're not seeing a general slice of the population. We're seeing a slice of the population that thinks we can help them with their pain, right? So everybody has pain. In that general pop of the primary care, some people may think it's 50% flus and colds and, GI distress, and it's only 5% low back pain, 1% shoulder pain, et cetera, et cetera. Therefore, thinking that most of what they do is not musculoskeletal conditions. But in your experience, tell me what you think the typical day, at least in that practice, was like. Like, what percent are they seeing with the issues we can help with?
Absolutely. I would average out about 20% of people going to a primary care physician's office. I don't care where they are, who they are, and what they practice, is going to be musculoskeletal related. There's other pain associations with other visceral type disorders, rest, but we're talking about strictly musculoskeletal symptoms. So the medical system in general is set up: hospital, urgent care, primary care. 98% of all visits of healthcare activity goes through that cycle, not us. We have to go and find it, right? It could be a combination of us and them, but it's even that 2% differential is not just coming to us. It's like so their system's set up for that. And the number one reason to go to the hospital is to be born. The number two reason is low back pain. So it gives you an idea of why musculoskeletal stuff is in that system, right? So if you have a primary care's office who sees one doctor with a nurse practitioner and sees 20, 30 people a day, or one doctor and a bunch of nurse practitioners, or two doctors and they're seeing 100 people a day, do the math, right? There's 20 people a day. There's 3 to 20 people, depending on the size of the practice, every day, not weekly or no, we look at our stats and try to get our numbers, but that's on a daily basis. Now, even if it's 20 that's musculoskeletal and half of those can actually come within our system to be treated, it's still 10 a day. Like, you can't handle the truth, right? the 10 a day is drastic, and it's right in front of us. So yeah, I mean, it's a sizable thing that we don't really go after, and it was intimidating to do so, but that's not the case anymore. You know what's intimidating is doctors getting sued for overprescribing. That's intimidating. Pharmacies going into this thing now, but they're getting sued. That's intimidating. Distribution companies who already gotten sued is intimidating. And all the pharmaceutical companies that make the drugs who have already been sued, that's intimidating. Not us.
I did a presentation for a local physicians group here. And the one comment that, afterwards, a lot of it was, hey, I didn't realize you guys could do so much. I really appreciate you coming. A lot of them expressed the concern, especially if they were like in their 50s. They're like, hey, I've dealt with some chiros a long time ago that gave me a bad taste in my mouth, but you're obviously different, which is great for my ego, So I was like, oh, keep talking. As many compliments as you want to give me, I'll take. But the one comment that was not about me that just totally stuck out in my mind, even to this day, was, thank you, because I just didn't know what to do with people who had pain. Right. Because they're getting pressure from their owners in the hospital saying, stop prescribing opioids. And their reaction is like, I want to stop. But this person in front of me is hurting, and I'm a human being who cares about people inherently. That's why I took this job, and I want to do something for them. So telling them to here's a pamphlet, read about pain education, it just doesn't fit with what they want to do. And you can't look that person across you in the eyes and say, this is the best course of care for you. They're going to think you're an idiot. And so the fact that they just didn't consider chiropractic on the map told me that's not them. We shouldn't blame the doctors. What you should blame is we're not getting out and saying we can handle this part of the market. This is where we shine.
You're 100% right. So our profession there's some futurists that are hired, NCMIC, Footlove, some of the big corporate guys. They hire these futurists every 10-year blocks. Futurists are like economists from some of the top places. They do mostly government and Fortune 1000 company work to tell you okay, this thing called the cell phone, it's going to last 2 more years and then it's obsolete because this is going to happen. So these guys.
Have you ever heard of Great Harvest Bread Company? It's like a bakery.
Yes. Yeah.
I sat next to a guy who was a futurist in 1997 who said, these little bakeries like this, and you'll see some other players come into the market, this is going to have a huge surge in about 10 to 15 years. And then he said, Great Harvest is the one I'm betting on. But he said, there's another one. It's weird. It has a weird name like Paneria or Panera.
Yeah.
and Corner Bakery. He nailed all of those in 97. Now, I didn't see them really take off until the early 2000s, but I know what you're talking about, a futurist, and he predicted that.
They're brilliant. They're paid to be brilliant because they can do trends. They know what gas prices are. They know what plastics are like. They know they incorporate everything. So when they did the study, they interviewed 2 doctors, chiropractors, each time they do the study. In the last 10-year block, I was one of the ones that was chosen to be interviewed. And I went through this whole thing, and this guy was an economist, I think from University of Maryland. And he's like, all right, we're done with the interview, but let me tell you something. You guys don't have a does it work problem. You got a marketing problem. Just to go off your point, like, it's not about whether it works. It's not about that there's not a need to be fulfilled, especially now during this critical time. It's about not knowing what to do and where to go with it. One, two, not understanding what the role of chiropractic and PT plays. And if we don't go out in front, you can't hang a shingle and say, all right, sit in your chair and wait. Like, I've not ever been that person. And I don't think people, if they're listening to your podcast, I'm sure are not those people either, because now they're already trying to educate and learn more. But it really does mean we need to get our butts out there. There's a book, The Tipping Point. I don't know if you've read it.
Yeah. Malcolm Gladwell.
Right. I mean, so you're talking about, and he brought that up too. He's like, John, anything over 12 to 15% of a population's utilization, it spills over to everyone. You guys are still sitting in like 8% in some regions, 12% in another region. The only ones that are over 15% are in pockets where the colleges are because people stayed there. But nationally, when you wait till it happens, because there's not enough chiropractic colleges in the country to be able to supply enough docs to handle the volume of people. It was exciting to get off that interview with him saying, holy cow. That was another piece of the motivation for me to be like, you know what? I'm shaking the cage everywhere I go. I can't. You should, some of the interviews, and you go online and you see some of the stuff I have posted up there. One of them at the White House, I'm in there shaking the cage on purpose. Like, I want to ruffle feathers and make people understand that they've missed the boat and they're not treating through pain. They're prescribing through pain. And that's just not okay.
Yeah. I love it. And I think when you said there's never been a better time, I would challenge anybody out there that if you just look at the research simply around spinal manipulation. Now, everybody listening to this podcast loves exercise. We all love giving active care. We might have other, class 4 lasers and tape and E-stim, dry needling, all that. It's all great. It's all effective. It all works, right? Mm-hmm. It's like, but just look at the research in the last 10 years about spinal manipulation and its effect on painful and just low back pain. Stick there. Keep a super small scope. It probably, manipulation probably works for plantar fasciitis as well, but I'm just saying stick to low back pain and stick to only spinal manipulation. So what I'm saying is the lowest, the easiest, the fastest, the default setting of our profession, right? If you come in and just crank on somebody's low back, adjust them and kick them out, we are blessed by the gods of healthcare that's going to do a shitload for that person. Yeah. And I mean, there's a reason, like, I know that a lot of chiropractors are worried about PTs, learning manipulation and all this stuff. I personally don't care. It reassures me that we are on the right track. They're learning manipulation because they realize it's incredibly effective as an entry point to this other stuff, to active care, to laser, to tape, all that stuff.
Right.
But manipulation is awesome and effective and super safe. I mean, it hits all the boxes that you want, right? Mm-hmm. Super safe, affordable. And I think just that small scope of, if you only talk to primary care providers about low back pain, you might be able to treat 87 different conditions well. But I'm saying just talk to them about low back pain and just talk to them about, how the research behind spinal manipulation and only the research in the last 10 years, you will never be able to stop talking for the rest of your life at this point. You could have that conversation 800,000 times before you die.
Right. And I have in my presentations, I have a whole section on what's up until sometimes each presentation, I add things in that the research just came out a week ago. And I just keep piling it on, that coming out of Yale, coming out of BMJ, coming out of the CDC itself. I mean, there's just massive amounts of material that we could use to our advantage. And Joint Commission has put stuff out. So you're right. It's there. And it's like the KISS method of marketing, and keep it simple, stupid, because the more you try to kind of talk in and you're talking in riddles and these people don't understand, they understand a couple of things. I got more patients in the waiting room than I do that are in front of me right now. And I don't have the time to explain all these things I can do, but I could whip out a prescription and tell them it's at CVS by the time they get home, they could pick it up.
Yeah.
They get into that mode of that ease of use, but then they see the cascade of events that take place where they're not getting better. And I got to tell you, in active care too, a lot when I have conversations with the system, the send to physical therapy that are not inclined to understand just pain. Most of them are rehab oriented, so they're post-injury, deconditioned people, post-surgical. They're not in that, like, the initial phases of care where we're doing pain control, passive modalities, range of motion, increased function. So that that gap in there, they send to PT, and then they come back complaining that, I got on a bike and I did these exercises and I can't move. I'm dying over here. Like, so having this integrative approach, like I never go in as the chiropractor. I go in as an integrative healthcare specialist, and then I pitch chiropractic as the gatekeeper to all those modalities. So I utilize the sense of, because look, I don't care if you have 7 different professionals in your office or just you. Do you do PT? You do, right?
Yeah, I mean, active care, like,
yeah.
Are you asking me a legal question?
Right. You do PT, you do rehab, you do manipulation, you do STEM, passive modalities, you do behavioral medicine.
Yep.
You bet your ass you do. Like, we're the best behavioral medicine people out there. We're not even formally trained in it because we lay hands, we have a conversation beyond than what anyone else is doing. So we're already an integrative practice without even saying you have other people in there. So that's a great way to get in and make the explanation. And the minute you have a handoff for them that makes more sense than just straight out referral to something that may have them back with more pain, or obvious reasons putting them on something and having to increase those dosage over time. They want the out. They really want the out now. I mean, it's never been a better time, I keep saying, but you can arm yourself in a way. It's scary. I mean, you literally have to stop your marketing at some point. And then who's ever had to say that? Like, usually we're trying to figure out, where can I waste more money?
Where can I go next? Yeah. It's funny. One of my mentors, a guy named Dr. Greg Rose, I don't know if you ever heard him speak, but incredible, smart guy. And he said he works in the world of golf, and he said he gave the same presentation, this, body swing connection thing, over 400 times. He said it might be 800 times, right? And, a lot of times I see chiropractors going out there and they're talking about something to the Rotary Club and something different to the Chamber of Commerce and something different to the Kiwanis Club. And then they're going to their gym and talking about it. And I think if you just get to, and one of the reasons is we think we need to come up with new material. And it's like, you don't. You need one single message to say, this is how to come in my office. And then all that other stuff you want to market or talk about or discuss, and how good you are with headaches and foot pain and knees and all that. Cool. Do it after they have already entered your office. Right. But if your only entry point is, another friend of mine, Dr. Jason Holm, is incredible. And he made it super simple for the doctors was, if somebody comes in and says they have low back pain, and the doctor's like, well, who should I send you? And instead of saying everybody, because that's going to turn the doctor off, he said, ask them to touch their toes. If the pain gets worse, send them to me. If it doesn't change, give them meds. And it was like, that's a pretty damn good filter. It's an 80-20 filter. But, he told the doctor, no, there's a small segment. Now, you and I know that ain't a small segment. It's like a trick. Like, filter off all the people who don't have pain with movement. Right. So that's one a week. But the other,
Right.
100 people a week.
That's the KISS method, right? That's what we're saying. That is it. Yeah.
And to your point, I think he says he has really 5 referral sources, 5 primary cares that just believe in him. And the guy's like got 3 people working for him, wants 2 more. Like, you just can't keep up. So awesome. So John, I know that you help people kind of develop this model and see this market, and we are certainly not done. But I just want to stop real quick. Where can people find more information about you if they're like, I want some guidance on this, I want to make a huge impact in my community?
Yeah, I mean, the drjohnrosa.com is like my main site that's got connections to my clinic, connection to my nonprofit work, and it has all my social media feeds. So it's DR without the period, drjohnrosa.com. And then I post incessantly on there, blog posts. review articles on a weekly basis and post things, and keeping people abreast of some of the stats and the stuff that's going on in that particular market. That's my expertise. But instead of having to go dig for it, why dig for it when somebody else has got 17 emails a day regarding the crisis and is sitting on a CDC call and gets invited to the White House to have a talk? So
the emails you delete are probably worth $7 million worth of business,
Yeah.
On a daily basis.
Insanity.
Yeah. But I think that the great news is, like you're saying, keep it simple, stupid. You can market your practice the hard way, trying to, motivate the teacher, the whoever. But I think the easiest way, like I work with golfers a lot. The easiest way to get golfers is you ready for this? Go to the golf courses where they go. Talk to the pro or the person at the front counter who's doing the check-in or whatever, and say, if you see anybody who has this, complains about their back, send them to me. Now, I could try and go individually to their houses or, get a list from somebody of people who have bought golf balls in the last 12 months and send them a letter. But I assure you it's cheaper, easier, and more fun to go to the golf course where they're already showing up and market to the person who controls that in conversation. Now, in the world of pain, what is the place they're going to where there's a single person in charge of that conversation? It's the primary care provider or an urgent care or whatever.
Yeah.
So hit those people up, man. And it's just, they need a method. They need help. They need assistance. They want it. And I think it's never been more acceptable to send to a chiropractor. I think we're just preaching to the choir here. I know that, but I just want people to hear it.
Like the steps to take, right? So for those who are aggressive and confident, just call or have somebody in your staff call, make an appointment. For those who are a little intimidated by the process, because sometimes it is intimidating, and especially early on, then you have patience. And if you're not collecting the name of their primary care physician in their intake forms, you're doing an injustice to your practice. Then you ask your patient, would you mind if I send your records to your primary care physician so that they know that you're being treated for this in case you see them for your normal visits and they want to ask how you're doing with it? And nine out of 10, it used to be 5 out of 10 because they were like, no, don't tell them. They didn't want me to come here to begin with. Now it's more like, oh, yeah, sure, that's not a bad idea. Then you start faxing your notes to the primary care physician's office, because if you have an office that has, 100 patients, chances are there's a primary care in that area that's 3 or 4 of your patients deep. When they start seeing notes that they now have to read and check off to say that they saw it in the file, they think they sent you the damn thing, because no one sends them anything unless they sent it. So it's a teaser. It's an easy way to, and then you have someone call and say, hey, doctor, we got so many patients in common. The doctor wanted to have a conversation with you about progress and some of the stuff he's doing. Now, all of a sudden, it's like, oh, yeah, I know that doctor. They don't know who the hell you are, but you forced yourself in there. That's a simple, really simple way.
So if anybody's listening, the one step to take that Dr. Rosa is talking about, the one step, if you aren't doing it, just start collecting the name of the primary care physician of every one of your patients. Just start doing that, and I'll tell you from experience, if you haven't done that and you have, few thousand patients, start asking them in the visit, like, hey, who's your primary care, and type that in. Because what I learned is the best patients for me came from a certain primary care provider that was, he and I jive. And when I finally called and said, I want to go to his office, I was like, yeah, I have like 25 of your patients. I mean, in the last month, I think I've seen 25 of them. Right. And he's like, oh yeah, I've heard your name come up. Let's have lunch. And it was the easiest conversation in the world. Now I have a few that have, one name came up or I went to a hospitalist. I'm like, okay, maybe if I have extra time and I don't want to sleep and I've seen my kids enough and I'll go to see that guy or that woman. Exactly. Yeah. But go to the
blow, right? It softens the blow. It's a warm call instead of a cold call, because they've already either you're not going to beg for business. You're going to talk about the cases you have in common, or just say, hey, we're working so closely together with patients that are in common that would love to catch up with you. And I have people sometimes that need a primary care, so it's just an easy, it's a must. Like when I talk to people and they ask for like, what do I do? Where do I start? The number one thing is collect the name. And the number two thing is send them stuff. Just make them think that they sent it to you. Just send it to them arbitrarily. Just send it.
That method, that recipe you just said, that works in dating. It works with your mom. It works. Like, why wouldn't it work here? Right. Like, if you just send your mom a Mother's Day card and some flowers, and when, you write mom on it, like magic happens. If you write, dear valued family member, that stuff doesn't work as well. So yeah, it works. Let me ask you this. I know that, for all those young doctors and maybe students listening, like, I think I hope you hear the core message of John's passionate talk here, which is the future is only as bright as you want to make it. There's absolutely no limitation to having the most impact and seeing patients and having a huge clinic that, serves the public, makes money, hits all the boxes you want, fulfillment, rewarding, all those things. And I know that there's some docs that have been in practice 10 to 15 years, like myself, that have seen this wave, and super exciting. Let me ask about the big stuff, the macro stuff, because you're involved in that kind of big level too. When you got to, say, the White House and these large groups, when they're asked by Homeland Security and these different groups to talk about it, sometimes people think that these groups have an overwhelming amount of information and expertise. My experience, however, has been they are probably less informed than the person on the street. Like they think that the problem's insurmountable, and you look at it and you go, you just need this thing. That's all you like. Yeah. This is a simple problem to solve.
It very well said. And yes, that they're by force, they're in a helicopter all the time. And the term helicopter view in politics and in big government, it almost has to be. That's not a bad, like, if we don't have that happening, then you're going to miss all the scatter. So
right.
You have to have that in societal stuff.
Here's one I heard is like, there were, where it was in the 40s or 50s, when somebody said we should have interstate highways that are funded by the federal government. Today, that idea of like the biggest freeways in the nation not being there, it's like, oh, Kansas will build a road up to this point, and then, hey, if Missouri wants to take it from there, they can, but it's not up to us. It's like, you need a higher level view to go, this just makes sense for everybody, like, travel and everything. Exactly.
And that's missing some. I'll give you a quick example of a meeting that I was at the White House on prevention. So this was in the previous administration, and it's the people who were the surrogates who were part of the prevention team. So there's prevention team, there's the media team, there's the medical side, the treatment side, there's the naloxone side. But in prevention, it's supposed to be talking about like prevention of the crisis, right? So I'm one of maybe 20 some people in the West Wing, and Kellyanne was running this. She was the point. Kellyanne was the point on these meetings. And I'm like sixth from her at the end, and it started around the other way. And it was this guy from New Jersey, Narcan distribution is up 400, 500% in my state. This is the number of how many lives that are saved. This is incredible. The next guy's like, yes, I'm going to talk about it too, because even now we're forcing prescriptions that are longer than 15 days to come with a prescription of Narcan. And we think that it saved this many, couple thousand lives in the, and they're going around, and they're all in a similar vein. And I stood up and I was like, Kelly, I gotta go. And she's like, oh, do you know where the restroom is? I'm like, I don't have to go. I got to go, like, get out of here. I said, I am so busy. I was asked to be here as a surrogate and an expert on prevention. And everything you have talked about so far is preventing death. That's great. That's the goal, right? But you're not preventing a problem. You're just, what everyone here is saying to me is that you're allowed to get addicted so long as we have enough places for you to be treated, or we have an injection to give you, or shove something up your nose so that we prevent you from dying. I said, that's not my expertise, but I can see by the number of people here, you're not going to get to me. I'm looking at my watch. I got to go. So she's like, Dr. Rosa, you have the floor for the rest of the meeting.
That's awesome.
And I went fucking bananas because then now it's like, now the conversation, and I said something simple because now I was like red-faced, right? Because I'm half embarrassed. I was half pissed. I'm like, now the floor is mine. What are you going to say? What are you going to
And now
say?
your Italian DNA will not let you A, shut up, or B, not use your hands to describe the massive problem, right?
1,000%. You're so spot on. It's not. And I told the story. I said, look, I go fishing every day, every Sunday at the hole, right at this massive waterfall with my two good friends, an emergency room doctor and a primary care physician. We get down there, there's bodies flailing all over the place. They're in the water by the hundreds and they're going over the water's edge to their demise. Before I could blink, the ER doc is at the edge of the waterfall, grabbing as many as he can, because that's what he does. I said, then I look at primary care physicians build a raft already, and he's out in the middle of the water putting people on the raft because that's what he does. Then they're screaming at me and saying, John, where the hell are you going? I'm swimming like an idiot to go. I said, I'm going upstream somewhere because they're either jumping in or someone's pushing them in. So I'll figure that out. You guys do what you need to do. I'll stop the flow.
Right.
And that's like the most simplistic way. I had not the looks I had when I made my comments were like, who the hell do you think you are? And when it was done, the people that came up to me and said, that was the easiest, most descriptive way of prevention, that we got to tackle this from the front end. And the front end is don't write the damn prescription for an ankle sprain. If I'm passing a kidney stone and I'm in the hospital, if you don't give me morphine, I will hurt somebody.
Right?
It's made for a reason. It's not made for the 90% of the people you're prescribing it for. That's our open window. That's our window.
Yeah.
And that's what you're saying, like that helicopter view versus not. Like they don't know the simplicity. And I told the story in reaction to what you said, because that was the most simple thing I could ever say to them. And yet it was so profound that it hit the brakes on treatment and pumped and
And it's funny at the highest level. I mean, we could say if you're meeting in the West Wing of the White House, like there's no other stage that will exceed that, right? I mean, I don't care if you're addressing the WHO or something, but the funny thing is to everybody listening, and I have experienced this in my own life. I'm hearing it out of your mouth, and you've certainly been on bigger stages and bigger meetings than I have. Nobody cares about the embryology. Nobody cares about the deep understanding of anatomy. Nobody cares about the chemical reactions that are going on. The problem is they need somebody who can simplify it and say, all you need to do, like you're saying, is that asshole up on the bridge that keeps like stopping school buses and throwing the kids in, take him out, problem solved. It's not how many rafts do we need to build. It's eliminate the need for rafts, like,
right.
And every high level meeting I've ever been in is like, if you can explain how simple that is and how it works at the street level, it's easy.
Yeah.
But the bigger it is, the more complicated people want to make it. And they do that sometimes to impress each other or whoever they're being hired by. But man, if you can just do you have people with low back pain? Yes. Ask them if it's worse when they touch their toes, send them to me. If it doesn't change it, keep them here. Like, I think just make it that simple for people.
If you use the issue, the crisis, the opioid crisis as a conversation point, when you know the data, own the data, and understand it. I mean, it comes out like verbal diarrhea for me because this is what I do. But when you start talking about the numbers and what it is that can be done and how it reflects on us, when you have 500,000 prescriptions for opioids written every single every day. That's not a month or a week or every day. And that's down from 650,000. Oh, whoa, hey, it's only 500,000 a day that we're writing prescriptions for.
Right.
200 people dying of an overdose every single day, half of which is from fentanyl, which they try to blame it. Now it's fentanyl. It's the illicit stuff. It's not the prescription. Well, when 80% of heroin users started with a prescription medication, you don't wake up in the morning and say, today I'm going to go straight to fentanyl, because you're dead.
Ask anybody that's been in the military for the listeners out there, ask anybody that's been in the military that's gotten discharged in the last 10 years, ask them in the military, what is a popsicle? Yeah. And they will tell you that it has absolutely nothing to do with a frozen dessert.
No, it's fentanyl. It's unbelievable. And you take you have all this happening, 200 people dying every single day. That statistic is daunting. And now it's gone up drastically during COVID and the mental health issues that overlay onto it. Then every year we're losing more people to an overdose from opioids than all the wars, last 3 wars combined. Vietnam, Iraq, and Afghanistan add up 32 years of war. Add up every death in 32 years, every single year we lose more people than we do to that. These are the stats. And then, so the number one reason to go to the hospital after being born is low back pain. The number one reason to get an opioid prescription in this country is low back pain. The number one thing we take care of that's easy to explain is low back pain. What the hell are we doing by not having everyone on this planet, at least in this country, at least in the state, or at least in the county, or the damn city that you practice? How do they not know those stats? How do they know those 3-4 simple things to have a discussion with your community, with the doctor who's around the corner, with the legislator or a council member, I don't give a shit who it is. Hallelujah, buddy. Go out and do it, right?
Yes. I hope everybody heard that. It is, there's never been a better time to have our license. There's never been a better time in the history of the world where everybody listening to this has the solution. The world is creating their own problem. We don't have to create the problem, right? We don't have to get people to like our French fries. They're already on a drive to say, like, we've got 200 people a day that, are dying from French fry related deaths. And it's like, we have the number one chance of preventing people from eating French fries. Like, if that was,
wow, right?
Yeah, this is our moment. This is our moment. So, all right. So for everybody listening, John, I don't know where the hell this could go anywhere higher up than this conversation we've already had. So for people listening that are like, this guy's preaching what I love, and they want you to help them out or get some advice on either setting up your practice, or maybe they have a big meeting coming up and they'd love to hire you to speak or for some consulting, where should they find more info?
Well, if they go to the website, drjohnrosa.com, they can have the contact us button. It literally goes straight to my email. So if there's anyone with a question or a request or want me to speak.
I picture your email like director of the NHS, vice president for, and then the next line is like, Milwaukee Chiropractic Center, and then the next one.
And I answer every damn one of them.
That's awesome.
I got 0 issues with it. I've helped people I've either spoke at conventions, I've done smaller things, I've helped people set up community type talks. That's another thing. Like, why? If you live in a community, there's a local community college, there's a emergency room doctor or nurse, there's a councilman, mayor, or somebody who it could be even higher up in government, and then there's you. Yeah. Why not do a little community get together on the opioid crisis? Every one of those people I talked about would love to take a stage, right? So, if the community college promotes it, you promote it, and the hospital promotes it. The chief of police promotes it because he could talk about what's happening on the legal side of things. Sure. And a councilman or a local politician promotes it. And then, or invite me. I'll come and sit on the panel as one of the experts in the integrative medicine. And then the doc actually is the moderator. So now you're the thought leader. You're the one running this. You have canned questions that are designed to get at those people. And then you take questions from the audience and you just have that talk of like, a community style thing. It gets the newspapers, it gets attention, and now all of a sudden you just created a method for these people to hear your voice. That's a great way to become a miniature expert right within your own community.
Yeah, I love it. Our conversation today reminds me back after 9/11, Las Vegas people were worried Las Vegas would become a target. I live in Las Vegas, a target for terrorism, right? And I remember our local liaison for Homeland Security, they said, what are we going to do? How do you keep it safe? Blah, blah, blah. And that guy, very wise man, said, everybody in this room, go meet your neighbors. That's how we prevent terrorism. Go meet your neighbors, know their name, know what they're about. He said the worst thing in the world for the FBI is they show up and want to investigate the guy living next door. And the person says, I never met him.
Right.
It's like, Like we could have been so close. And it just comes down to relationships. And it's like, to solve the opioid crisis, just meet your local primary care providers. That's it.
Right.
Whether it works or not, you gave them the chance, but hey,
just show up.
Just show up. Yeah.
Show up.
All right. All right. Well, John, we really appreciate you being on today. This has been, I'm charged up. I'm excited. And I hope everybody listening is. Once again, it's drjohnrosa.com. So if people want to go there and find some more information. And John, I say this every time, but this interview probably perfectly encapsulates everything that we're about when I say, go out there, maximize your license, and live the life you dream of. Thanks so much, John.
You're very, very welcome.
Thanks so much for checking out these videos. I hope they're useful. We'll cover things like rehab, exercise, business model, progressions, layout, everything else that helps you build a clinic. So if you're interested, you can click here, there, here, or anywhere to get more videos just like this. Thanks a lot for watching, and we'll see you soon.